Hi, I'm Dr. Anthony Licatese, and this is my associate, Dr. Ryan Barker, and we're going to explain why poor biomechanics when sitting up can cause a lot of unnecessary low back pain.
We often have patients transition from the sitting to standing position and end up with more pain in their back.
So Dr. Barker is going to demonstrate by showing the poor way to stand up and why it causes more pain. So let's show them how when you stand up it causes more pain. So right from there, we start to see pressure on his low back. And then from here, no matter how much he uses those strong legs, it's going to cause, he's stuck. So he's going to get pain the whole way up. So let's see the rest of that arc. Right. So pain, 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 all the way up. And we're going to actually show it in real time now to see what that actually looks like again.
So we have patients start in a low seated position, and as they come through, they end up with pain all the way through the transition.
And sometimes that could take a long period of time. It takes a while and they have a lot of pain, and then they complain that it takes them a long time to even get up if they can at all. Okay, so let's show exactly how we would want patients to stand up without the pain. So what we want to focus on is proper body position and maintaining what's called the lordosis, or the curve in the low back, okay? And then from there, all of the power is going to come from the legs. So let's sit up nice and tall, chest nice and tall. We got that nice curve in the low back. If you want to come around and show the curve in his low back there. So we could see that arch right in his low back that he's going to try to maintain as he goes through the standing position. And you could stay right there to film this part. So if we could get right to the edge of the chair, scoot yourself forward. There you go. Keep your feet about shoulder width apart. Keep the chest nice and tall. And from here, he's essentially standing right now. He's standing without standing. All he needs to do is use those strong legs to get him up from that position. So let's try to stand from that position using those strong legs. You see how much easier? There was no strain on the low back. Let's do it again. So from there, we're going to look at that low back, and he's going to go up without any problem. You could have a seat. Okay. Another thing that you could do, you could stand over there now. Another thing you could do is the patient's always going to follow their eyes. Okay, so if they're looking down as they stand up, so if we look down and then we stand up, we're going to get that painful arc again. So another way is you're starting to get used to doing this. Another thing you could do is actually look up. I mean, whether it's the ceiling or the sky, if you're outside, if you look up, you're going to follow those eyes. So you're going to see that as he stands up, his head's going to go up and he's going to follow that and keep that nice back position. Okay? The other rule of thumb, if you could sit down again, Dr. Barker, the other rule of thumb is don't ever let your chest or head go over your knees. Okay, that's a little bit more difficult to constantly pay attention to, but you can see as his chest comes over his knees, then we start to lose that lordosis, or that curve in the back, and then we start to get a lot of pressure down there. So if you can make this habitual, if you can make this part of your everyday life, you'll see that those painful transitions, especially when you're stiff in the morning, or if you have back pain, you're going to see that it's going to be a lot easier for that back pain to get better, and we could also avoid re-injury.